This presentation is on phenomenology by Andrea Henricks, Andrea Oprika, and Amari Williams.
Phenomenology is a qualitative research method that's all about exploring lived experiences. Instead of focusing on numbers or variables, it digs into people's personal stories and how they make sense of what they've been through. The goal is to find the shared essence, the common meaning across people's experiences. In nursing, this is really useful because it helps us understand what patients and even nurses are going through on a deeper level, which can also shape more compassionate, patient centered care. The process of phenomenological research usually follows a few key steps. First, the researcher identifies the phenomenon they want to study, something like living with chronic pain or experiencing loss. Then they recruit people who have actually gone through it. Data is collected through interviews, journals, or even observations. A big part of the process is bracketing, which means the researcher works to set aside their own assumptions so they can really focus on the participants' perspectives. After that, the data gets analyzed by pulling out important statements, grouping them into themes, and describing the essence of the experience. Finally, the researcher puts it all together into a narrative and may check back with participants or peers to make sure the findings truly capture the experience.
A study by Tuna and Karaman titled Manager Nurses' Views on Male Nurses, a Study of Phenomenology was published in the Journal of Education and Research in Nursing in 2024. The authors noted that nursing has been historically viewed as a female profession, but there has been a rise in male nurses in this profession. However, males typically face barriers in the nursing profession which may be inhibiting more males in becoming nurses. The authors further highlighted the need for the profession to have both female and male representation. The purpose of the study was to gauge nurse managers' views on male nurses, the advantages and disadvantages of working alongside male nurses, what they contribute to the profession, and their future role in nursing. The study was a descriptive qualitative design utilizing transcendental phenomenology. The study participants included 22 nurse managers who were all women and had a minimum of 2 years of experience working as a nurse manager. Data collection was done with face-to-face interviews that were recorded. In each interview, 10 questions were asked, and the interviews lasted anywhere from 45 to 60 minutes. The authors noted average time of an interview was typically 51 minutes. These interviews were conducted between May and December of 2018. The data was analyzed through a multi-step method. First, data was transcribed, then coded line by line. The data was identified and then classified based on themes. The researchers then found connections between the themes and finalized results, then created a report. The results yielded 5 main themes with 15 sub-themes. Further delved into the results of the study, the first theme is perception and contained 3 sub-themes, which were gendered prejudice attitudes, social need, and being perceived as a physician. The first sub-theme with the gendered prejudice attitudes, nurse managers reported that female patients were typically prejudiced against the male nurses, sharing sentiments like female patients tended to react negatively toward male nurses. An example given was female patients did not want male nurses giving them injections or insert a catheter. In social need, nurse managers shared from a perspective of patient privacy, female patients liked receiving care from female nurses, and male patients liked receiving care from male nurses. It was further noted that having both male and female nurses balances out the work environment. Male patients especially perceived the male nurses in a positive manner. The last sub-theme was being perceived as a physician, noting that family members typically viewed male nurses as physicians and as patients as well, which would lead the male nurses to go beyond their job description. Male nurses being perceived as physicians, they tended to get more respect than the female nurses and were looked at as more superior, which also instigated conflicts with female nurses. The second main theme is advantage, containing 3 sub-themes, which are fewer responsibilities in private life, not being a mother woman, and high muscle or physical strength. The first subtheme with the free responsibilities in private life, nurse managers noted male nurses had less responsibilities and it made it easier for them to work with. Typically, their priority is providing a live-in and they would place their work above social needs. Not being a mother/woman, it stated that it was easier working with male nurses. And an example that was provided was female nurses who have children may not want to work nights. But nurse managers felt it was not fair to assign all night shifts to those who do not have children, and so they favored having the male nurses as an advantage. The last one was high muscle physical strength, and all the nurse managers noted that having male nurses is important on units that required more physical strength. The third main theme is disadvantage, which had four sub-themes. These sub-themes were lack of meticulousness, dislike of paperwork, being rebellious/prone to conflict, and difficulty in empathizing. In lack of meticulousness, nurse managers highlighted that male nurses typically are less detail-oriented when compared to female nurses. In dislike of paperwork, it's noted that male nurses had difficulty tackling some of the documentation. This is an area of weakness and disorganization among male nurses. Being rebellious and prone to conflict, it's noted that nurse managers shared that male nurses often had rebellious personalities and are more inclined to conflict. The last subtheme is difficulty in empathizing, and it's noted that male nurses are more task oriented, completing duties without empathizing with patients. The fourth main theme is professional contributions with three subthemes. This includes reducing conflicts in the work environment, reducing the level of violence experienced by healthcare professionals, and enhancing the occupational image and sense of security. As highlighted with the reducing the conflicts in the work environment, the presence of male nurses helped to decrease conflict among the female nurses. And in reducing the level of violence experienced by healthcare professionals, male nurses tend to act more confidently. If one of the staff members is in a violent situation, they will step forward to intervene. Enhancing the occupational image and sense of security, the nurse managers noted that having male nurses present increased the confidence in female nurses. A specific example that was given was that male nurses in the profession have changed how society perceives the nursing profession. And with both female and male nurses, it has brought out a bigger sense of authority in general for nurses in healthcare. The last main theme is future roles with two sub-themes. First one is distancing from the work area, which one manager indicated that male nurses could move towards more managerial positions, while other nurse managers felt that more nurses would enter the profession due to the ease of employment, which brings us to the second subtheme, ease of employment and economic factors. Most managers felt that male nurses will increase with the need of ease of employment and job security, especially with the nursing shortages. Limitations of the study, as noted by the authors, included that all the managers were females and the study was conducted in one country. There are also not many previous studies on this phenomenon. This study utilized phenomenology by conducting interviews that were descriptive and detailed, collecting qualitative data. This allowed them to acquire the perceptions on male nurses through the lived experiences of nurse managers.
Phenomenology, despite its usefulness in the context of revealing the profundity of lived experiences, has a number of drawbacks for researchers. Among the significant problems, it is possible to note that the researcher's bias may affect the interpretation of the data and influence the process significantly as the work is based on subjective analysis. Although bracketing is recommended, it is extremely hard and not always completely feasible to put aside one's own assumptions. In addition, a phenomenological research process needs a lot of time in data gathering because both transcripts and in-depth interviews are voluminous, as well as data collection. Besides, the participants will likely not articulate their lived experiences using words and provide incomplete or vague narratives. Small sizes implemented within phenomenologies also do not allow the sample to be pushed to a large population. Lastly, qualitative data is a very subjective procedure to watch as the researchers need to know how to interpret narratives and what is being comprehended in the theme. depending on the point of view. Those issues point up the thin line that must be kept between rigor and authenticity in using phenomenology. Phenomenology also has some limitations that the researcher should consider when using this technique. First, it is impossible to reproduce the results because the research is based on personal experiences and representations. The implication of this non-replication is that the findings cannot be extrapolated to the entire population, and thus one cannot make generalized findings. The method is also dependent on the memory of the participant because of emotional bias or recollection. Moreover, the issue of a phenomenological study is conventionally heart-wrenching or sensitive and may be painful for vulnerable individuals to relive traumatic events. The language usage is also a drawback as the words only lose or are misinterpreted in translation or transcriptions. Finally, phenomenological demands that a researcher be more than endowed with analytic and interpretative brilliance because the researchers must have the power and reason to elicit the kind of experience in narrations. Collectively, those restrictions demonstrate that phenomenology must be planned and ethically considered.